Okay, so I think
yes, we can go ahead.
We can start. Sure. So welcome to again our Kawakib webinar series. It's a pleasure for me to welcome and introduce our guest for today's webinar. He is a cultured and very modest colleague who grew up in a very dear city, which holds a very dear place in my heart, Aleppo. Must have tasted a lot of very good food, actually, as well. Our speaker today
and
is...
music.
Huh?
And the music.
And أكيد and music خاصة إذا بتحب صباح فخري. So I'm welcoming Dr. Fuad, who is an associate professor of public health practice at the Faculty of Health and Sciences at AUB. He is also co-director of the Refugee Health Program at the Global Health Institute, also at AUB. His current research focuses on the forced displaced population, with a special interest in the Syrian refugee crisis, as well as the impact of this crisis on the health and the well-being of the Syrian population. Dr. Fuad has extensive research work on health workforces in humanitarian settings and the weaponization of healthcare in armed conflicts. He is also a principal investigator and co-investigator on several projects related to health in protracted and armed conflicts. He served as a commissioner in 2 Lancet commissions, the AUB Lancet Commission on Syria and the Crisis in Global Governance, Health and Aid, and the UCL Lancet Commission on Migration and Health. Dr. Fuad is the author of more than 70 articles, op-eds, and reports published in top journals, including The Lancet, PLOS, PMJ, Conflict and Health, and others. What also makes me very happy having Dr. Fuad with us today is that he is a person who speaks from the heart. So to him, this issue is not a theoretical exercise. There is really a lot in him that wants to fight for the issue of refugees. So I think you are the best person to speak about this topic, and I really welcome you to our webinar, and thank you for joining. The floor is yours.
Well, thank you, Talia. Thank you very much, Yani. It's really a great pleasure to be with you and to have such, as mentioned before, Yani, I would like to have it a sort of friendship discussion, debate, chat. So it's more than, it's definitely with having you, Sari, Judy Makhul, Rima, so all other colleagues that are experts. They are expert in different topics, including ethics and displaced population and all these issues. So I'll be part of this group. And to be honest, I didn't prepare, presentation or few points just to put it in front of me, just to remind myself of some points. But I would invite you to not just interrupt, but also to have part of this webinar to bring whatever you think are important in this topic. Just want to start with the issue of the context in Lebanon and in the region. And as you know, this is not an emergency or not a sort of event that happened in the last decade. We're talking about long-term crises in the region. With starting from the Palestinian question in 48, and all that wars and political instabilities and movement and civil wars. So ended up that now, I guess we are in the worst situation comparing with what happened in the last 50, 60 years, with losing not just lands and territories and countries. We lose actually hope. I mean, it's difficult now to think about what could happen after few years, given all what we live in now. Anyway, so if we think about one issue that comes to mind immediately when talking about refugees, and especially refugees in Lebanon, is the issue of legality. As you know, refugees, the Syrian refugees in Lebanon are legally, or by law, by definition, are not refugees. They are displaced population. They are, I don't know, guests in some, nice words. They are, people that seeking sort of safety, but by law they are not refugees, as the definition of refugees by UNHCR in countries that signed the 51 Convention. That's a major issue when thinking about their situation in Lebanon, and actually to some extent even in Turkey, although in Turkey they host the vast number of refugees, not just of Syrian refugees, but global refugees. They have more than 3.6 million Syrians, but in general they have 4.4 million refugees in their territories. But not all of them, actually, less than 25% of those refugees has such a sort of legal status. And also, as you all know, refugees in Turkey and Lebanon were always sort of a play card. So whenever there is a sort of a political issue, we raise up this and negotiate about the position. So legality is a major issue, and as you all know, legality here has a strong impact on their health, because that will affect their access to health facilities. And you may know that when Syrians start to come to Lebanon, waves of increasing, starting from 2012, and then the peak in 2015. So at that time, they were able to register بالأمن العام, general security. So pay 20,000 Lebanese lira at that time in 2013, and then they can get a sort of a residence, a permit to stay. What happened that in late 13, the Lebanese government raised these fees, the annual fees, from $20,000 to $200, 300,000 that time, $200. So what happened that in 2013, the number of Syrian refugees who have legal documents were almost like 85 to 90%. And by time, this number declined dramatically. And now, among almost 1 million, it's less than 1 million registered refugees, less than 15% have this legal document. So 85% have no legal document. And we're talking about one category, which is the registered refugees. But at the same time, in 2015, the Lebanese government asked UNHCR to stop registering Syrian refugees. So since then, any refugee or any wave of refugees that come to Lebanon, they couldn't be able to register at UNHCR. And what happened, UNHCR did something, they called it recording them, but not registering them. Anyway, it's something we can discuss later. But those who are not registered, it's not just they don't have a legal status in Lebanon, but also they don't have these few benefits that being registered can get it, including access to primary health care and basic education. So given all this introduction and complexity, ended up that Syrian refugees have little access to, I mean, they have access to primary health care, but there are some challenging, but they have a sort of limited access, say, to health facilities. First, as mentioned, all these issues of registered, non-registered, but second, the issue of legality and movement. So people in their informal tented settlement, they cannot move away from that, and therefore they cannot seek, health. During that sort of course of living in Lebanon, a tension arose between refugees and host communities in many parts. As you know, 85% of Syrian refugees in Lebanon live with almost 65% of the poorest Lebanese in Beqa in the north. So poor live with poor. So and that means they are competing on very limited resources. And I myself, saw several cases where people, complaining, that Syrians can get access to health facilities, whereas we cannot, and so on. That's why now many organizations, do any intervention that including the host communities. Let's come to our issue of COVID, and let me show you these few points that I want to do now. Okay, can you see it, please?
Yes, thank you.
Well, so when the debate, the discussion about the COVID vaccine started last year, and as you know that the main industry are in the developed countries, including US, UK, and part of Europe, but now a bit in India and China. Since then, the debate started about who deserved to get the vaccine. And, because of the limited resources, because of the, the sort of the risk group of populations, so the workers in health, scholars, ethic people, they put this list because of the nature of disease. So the frontline workers, health workers, the old population, people with chronic diseases, they could be, the first to get the vaccine, and so on. The less and less and less. But if you see all these issues of, who deserve the vaccine, there's nothing clear about the marginalized group. Those who are, very vulnerable, population, including, of course, the refugees or IDPs, internal displaced population, and the most difficult group, which is the stateless persons. By the way, because of the issue of registration, birth registration, we have now in Lebanon many newborn babies that are Syrian refugees that are stateless, and this is something we can discuss later about the issue of how this will be in a very big issue in the future. Anyway, so those marginalized group are not in any of the clear literature about this, how they would be provided with vaccines. Second is that even those live in countries themselves that are marginalized in the global stage. And if we take Lebanon as an example, we know that Lebanon, itself suffers a lot from, what they called it triple-fold crisis last year. Economic instability, Corona, and the Beirut explosion, and that left, the country itself in a sort of very difficult situation, let alone talking about corruption, political sort of exploitations and all these issues. So if the Lebanese themselves are marginalized, so how to be sure that we can reach the most vulnerable group of this population, which they are the refugees and the IDPs. So this is a big question about that. Given that we're talking about, the issue of tension and competing, to say, on these resources. Well, so that's what, magnifying the tension between the group. One issue also to raise it as a sort of a point here is about the recruitment of vaccine. As per now, the vaccine procurement has been left to individual countries to buy the vaccine from the industries, and up till now, still. International organizations are unable to acquire vaccines for their vulnerable population. They can do that through the government, but not directly to their vulnerable population, which is put like a sort of a big question about how these organizations, UNRWA, UNHCR, can serve the refugees. Given that we know from research and from statistics that even the routine national immunization program, is a challenging. In Lebanon, we know that the coverage rate of national program for refugees, are less than a third. So we're talking about an issue of how we can assure that those people have access to vaccines, to COVID-19 vaccines. More factors that could put like a sort of practical barriers on that and can play a role on this is the issue of discrimination, distrust of authorities, the issue of hesitancy of vaccine, that because of media we have this what they called it disinformation that's now on media and social media. As mentioned, there's issue of documentation and legal status that could create a sort of difficulties in access to that. Access to information, or to the right information, is another barrier that play a role, and the lack of data about some specific marginalized population. For example, the old population among refugees, or those who have specific chronic diseases that we know will play a role in coronavirus severity, including diabetes and hypertension. So lack of information, in addition to all these other barriers, put the question of the main question that we talk about, the ethical issue, is a bit really challenging, because when the simple question, if we ask this question simply, saying, well, can we distribute the vaccine, equitable to all population in a specific country, in specific setting, the answer would be definitely yes. No one will say no. Although, by the way, while reading something about the topic, I read an interview done with Dr. Arthur Kaplan, Director of Division of Medical Ethics at NYU School of Medicine in New York City. And it's like he's the man of ethics, and they ask about many issues. And I was shocked when I read asking about, well, how should we do to be able to distribute the vaccines to people outside the US. And actually the question, I cannot find it now, the question was exactly that. If we're talking about the vulnerable population that are affected, that are at risk for COVID, old people, people with chronic diseases, they have the priority. Well, the second question is, well, after those priorities, should we go with less priority or we go a different setting? I don't know, in Africa, to give to the most people at risk, the old people, population in Africa, old people. Interesting, he said, no, we should start, we should complete doing that in the US. And he brought this example of when you are in the flight, in the plane, and you have the security instructions that help yourself first and then help your neighbor, like regardless of son or daughter. So he used the same example, that we should help ourselves first and then we can go outside, because if we don't do that, maybe we will make our population at risk. And I was actually asking myself, I mean, with this big question about who should be served first, and that's why using this term, vaccine nationalism. So should we, when talking about justice, when talking about equity, are we talking about an entity that among specific territory or territories or country or a group of population to serve the people of this country, and then we go and serve others? And if the answer is yes, so what? So does it mean that even inside the country, so there is sort of also of priority when talking about citizens versus resident versus displaced versus stateless? So there's sort of hierarchy in doing that. And even if the answer is no, how to be sure that those who have no document, or have no good information, to also to be able to have access to the vaccine. I will stop here. I hope I just I open the discussion, and would happy to listen and also share with this sort of conversation. Thank you.
Thank you very much, Dr. Fuad, for raising very important questions on many levels. I'm going to maybe abuse a little bit my position as co-host, and start by one question, particularly because I don't think, I'm sure the questions are going to concentrate on Lebanon particularly, and perhaps a little bit more on Syria. But I'm wondering about Gaza. So Gaza, we all know, is the largest open-air prison. It is a city where many people are refugees in Gaza itself. So it seems to me that there is some form of state of exception, or necropolitics or biopolitics, that decides who gets to live and who gets to die. That is being followed by the authorities, if you wish, there. And they have been denied vaccine for quite some time. My colleague Stephen, who's with us today, and I had the opportunity to write an op-ed in the Lancet about this, and it was published. And only 2 days ago, I read that AstraZeneca was not brought or sent vaccines to the Gaza Strip, and the authorities refused to let them in. Today, they let in a few of these vaccines. So my question is, where do United Nations or all UNs, if you want, human rights agencies, public health authorities, even if I may say جامعة الدول العربية, to be ironical maybe, stand? Why do we keep them as authorities when they really don't do anything to help the other, particularly since I see the problem of refugees, a word that I don't like to use usually, the term refugees, is that most people tend to look at a refugee as the other. And this is at the root of most of the problems that we have. Thank you.
Thank you. You know what? I hope there's no one from UN agencies with us now, because they may not be happy with what we will say about this issue of the politics of the humanitarian system, including UN agencies that always, say they are neutral and they want to serve, their, according to their mandate. But we have now, we know, every one of us, we have this long list of the issue of failure to address people's needs because of the issue of, not to say political bias, but sometimes political hesitate, or at least, they step back because they don't want to have trouble with the government or with the regimes, and not just, by the way, here, I mean, in many parts of the world, we have this big example about Haiti and cholera there, and also the example about the emerging polio in Syria in 2014. And we have, 3 years ago, there was a sort of siege in Madaya near Damascus, and people actually starved. I mean, dying because of starvation. And OCHA put a report. It was like a sort of nice report, really, about the situation there. OCHA is the UN coordination organization, it's a sister of one of these UN agencies. They put really a nice report about this. And then that report, as per, I don't know, the regulation, they should send it to the ministry that's, related ministry in Syria, which is the Minister of Social Affairs and the Minister of Foreign Affairs. What happened later, we knew that from The Guardian, because they published, the journalist was able to publish paragraph sections of the original report by OCHA and the published one, and where they removed all these issues about starvation, about blaming the government, not allowing, and when they asked the, people at OCHA in Damascus, they said, no, they didn't hide that. What happened? They said, yes, by mandate, we have to send the report to get the approval from the government. And this is the problem. So that's the issue of when they want to have a role in to intervene in specific needs. The problem is if this is not with the same line, with the mentality, with the ideology, with the political perspective of the government or the regime, that means they have no power to do anything. And that happened and will happen when talking about also COVID and vaccination, and cannot unfortunately we cannot disconnect politics from UN agencies, or not just UN agencies, all the humanitarian structure and system. And that's what we see in Gaza, that's what we will see in Lebanon, definitely in Syria. I mean, Syria is a misery today. I mean, there is nothing about doing testing for COVID cases. Last number I was able to collect, 200 doctors, not just health workers, 200 doctors died because of COVID. 200 doctors in countries that suffer a lot from the lack of human resources, health resources. 200 doctors died between last July and today. And even though there's no program, there's nothing about the issue of COVID. And when you see the literature by WHO, they know that. They said, what to do. Anyway, so sorry, I think there are many good answers with colleagues on the back.
Yeah, it is problematic anyway. Thank you very much, Dr. Fouad. I'm going to leave the floor to participants. And Ms. Miati, you're in charge.
I think Sari raised his hand.
Yes, I want. Dr. Sari?
From?
I think yes, you had
the floor for me. Okay, thank you so much, Fouad, really for very interesting reflection about status, if you like, and the nation state and the access to health. First, I would like to comment to Talia question about Gaza. I mean, Gaza suffered from double blockade. One come from Israel and one come from Egypt. And we should say that there is so much casualties of Gazayan people that they cannot go to have their treatment as usual in Egypt or abroad. They die. So the problem of Gaza is really terrible. Now I come to you, Fouad. Fouad, well, I think that in Westphalia conception of a nation state is really to provide a basic services to population. It means his health and education. And in the case of Lebanon, we start thinking whether Lebanon in the last few decades, whether it's a nation state or not. So it means that we need a serious reflection the access to health specifically for the population of Lebanon, whether they are Lebanese or not. We should think about internationalize this service or privatize it. It means that we need to think outside of the box of the nation, of the role of the state. Unfortunately, again, I am not a neoliberal thinking the state should be obsolete in service providing or in economy. So this is my first comment to you. The second and the last one, when you put a hierarchy of a status of population resident in Lebanon, I was waiting that you distinguish between protracted refugees, the case of the Palestinians where you have 4 generations and they still treat them as a population of exception, and the Syrian one, which is in sociological definition, they still under emergency refugees. Emergency refugees is 10 years. It's almost will move very soon not to be an emergency refugee. But at least there is difference between protracted refugees and emergency refugees and should not have the same treatment. Okay, stop here.
Well, thank you, Sari. In fact, that brings to the issue of, we discuss, people, my colleagues here, they know this debate and discussion about the health system in Lebanon. It's fragmented, and we know that. Everyone knows that the health system is divided into several, form of health, to say it in that way. So we know that there is a sort of this national health system, offered to the Lebanese. But this system by itself is mostly private, and the small part of it is public, almost like less than 20% served by public sector. And some are insured, 50% or less, a bit less uninsured in any sort of insurance. Then you have the Palestinian refugee, the protracted Palestinian refugees that are served by different system, which is UNRWA system. And this is a parallel system, parallel to the health system, the national health system in Lebanon, in the same country. There's a system run by an organization, which is, that this is also an emergency organization, renewing every 3 years since 70 years. So they have their own system. I mean, of course, there's sort of connection with the national system, but they have their own system to serve their own population. And then we have the Syrian refugees, which is almost to be protracted. And they are partially served by UNHCR, that they said they are working with the government, in coordination with the government, but to some extent, they have their own financial system, they have their own package to serve those populations. They cannot say to the government, well, let's have, bring vaccine, COVID vaccine to them, and I do that. No, they have to do that through the government, but also with some specific issue for them, including that they cannot pay for secondary and tertiary care. They pay in limited and with condition. And there's another system, which is the informal health system that's grown up in Lebanon in the last decade, because part of those vulnerable populations that cannot have access to the national system, nor to the private, or of course outside of the UNRWA mandate, so they are served now with informal health workers that working with those people. This system is another parallel system. So when you have in a small country like Lebanon all these issues of complexity of the system, you can imagine that, well, you're right, we need now to think out of the box. So what does it mean to have universal health coverage? To what extent this universal will be universal? And how this universal health coverage will overcome the political definition of the person, I mean, citizen versus protracted refugee versus less protracted versus state. So, how you can build this system that can serve regardless of this labeling, definition. I will stop here because this is a long story.
So if anyone else would like to ask a question or make a comment, you're welcome.
I think make a comment much better than asking. I mean, I want to listen.
Yeah.
Yeah.
Okay. We invite comment as well.
I did not raise my hand because I did not find the button to raise my hand.
Yes, sure. Go ahead.
Okay. Thank you very much, Fuad. As always, you put your finger on the wounds and you remind us of this miserable situation that we are facing in our countries. Yes, you mentioned Gaza, and Sari rightfully so mentioned that it is under under sanctions and under embargo from several fronts and by several powers. And I enjoyed listening to this theory of the marginalized and how the disenfranchised can be categorized also. The poor in a country, those who are refugees, and the permanent refugees versus the non-permanent refugees, and how we refer to them. We recently, the department, actually, all our department, the Department of Environmental Health, collaborated with the Arab Forum for Environment and Development, and we produced a report. And we took the opportunity to talk a little bit about COVID-19 and the situation in the Arab world, because the title of the report was Health and Environment in Arab Countries. The facts are shocking, just shocking. We found that the case fatality ratios in Yemen was 29%. The next country to follow was at 6%. Of course, I understand that in Syria there is no data, but also in Yemen there is no data. And they managed to produce these facts from the United Nations dashboard and the Johns Hopkins dashboard as well. So we could borrow this data. So when you think about the Yemenis who are not refugees in other countries, they are still citizens of their own country, and yet they cannot access the vaccine, and the case fatality ratio in Yemen is the worst in Arab country, and probably the worst in, you have to discuss India, perhaps, and other countries that are densely populated. And that's why they have these high rates with high levels of poverty as well. But where would you rank Yemen in these situations, like in this in the theory that we are discussing about refugees and marginalized and ranking and who comes first and who comes second? I like your comment on this, because those numbers, when I was writing on them, shocked me when I saw the discrepancies and the differences in rates. 29% drop to the next level is 6%. Thank you.
Well, thank you, Rima. Really very, very, very difficult, very hard to see this. I cannot imagine that such a sort of numbers that people live in. But you know what? Again, you're right about this issue of labeling, and it's not just labeling in the international definitions of those people. We talked about refugees and stateless and citizen, and you mentioned something about IDPs. Maybe in some countries, like or even people that are living in their own country. The IDPs actually, by definition, they are in their country. But what if the country is divided by itself in sort of different power control? So people live in this one of this territory or controlled area or by different power, and they don't have, the same right of the other one that live in the same country but in a different power controlled area. And that's the issue in Yemen, now the issue in Idlib in Syria, and the issue in even some part, even in the as I know, in the areas that controlled by the Syrian regime in Syria. If people are living in IDPs setting, collective shelters that now are many in the coastal side in Syria, they are, there's sort of discrimination even against them. And I've heard it several times. They said those al-Halabiyya, they brought this issue of their behavior to us, and so on. So they have this label about, issue of, and that's, I mean, then their access to all these facilities could have under this question mark. That's why I think the issue is really more it's deeper than just defining this with the outline of political difficulties or clash or tension. I think it's some of them are even in the issue of the social rooted sometimes, and that needs, again, like Sari mentioned, maybe we need to think differently now about how to define even the state. What is the state? If they cannot offer even to their citizen, they cannot offer their basic needs. What is the state is about? But I'm happy to listen to others. I don't know. I am not the moderator.
So I just want to maybe pick up on the points that Dr. Habib and Dr. Fuad were making. So what we're saying, maybe perhaps one of the things that are missing is also the conversation with what we call the host community as well. I mean, if we're talking about all these definitions and labeling the refugees or the displaced populations as the other, and so what is the role, maybe, or what can be the role of the host communities themselves, especially as we're talking about and it's on a much bigger level, not just the political context. Maybe that would help break some of the barriers and initiating this more active conversation between the communities, and it's not just an issue of political regimes and international organizations acting as a foreign body onto populations themselves. I don't know if that makes sense.
Yeah, it makes sense.
So
problem, Anna, is we cannot unpoliticize, unfortunately. We cannot unpoliticize anything in this universe anymore. And politics is defined, at least by my dictionary these days, as corruption all over, or some political factions, or not even factions, with this rule of capitalism, neoliberalism, colonialism, or what have you, and the commodification of healthcare, that's the issue of the vaccine, that is actually widening the gap between the less advantaged and the more advantaged, however you would like to define these two terms. So, yeah, highly political. Any other questions, comments?
There's
I know.
hand raised.
Yes, sorry. Yeah, thank you, Dr. Fuad. Thank you, Dr. Arawi, for this. It's very interesting. I wanted to ask about the inclusive vaccination strategy. So since Dr. Taria, you are also in the Committee for Public Health, Ministry of Public Health in Lebanon. And now we're talking about inclusion, including and equity, right? So shouldn't be the Ministry of Social Affairs be part of this committee? And shouldn't they prepare some inclusion plan for everyone? And also we shouldn't also forget that we have disabled people, even with the refugees. I don't see that there is something in the plan for the disabled, how to reach them, how they're gonna I don't know how they're going to take the vaccine. We have, and if they are not part of an NGO or anybody who can help them. So it's just like a general question about equity. Thank you.
So thank you, Mrs. Vahira. Dr. Fuad, would you like to address this since you are the guest?
No, it's not about guest. We all guest. It's question to you, yeah, Talia. It's a practical question.
So from the little I can share, I can tell you, بالوزارة, yes, there are representatives from different groups, if you wish, and there is a plan for those who, for the quote-unquote disabled. مين عنده عصفور؟
Oh.
Hi, هذا أنا. I'm sorry, I should have muted myself.
I love it, Julie. I love her or him, I don't know. So there is a plan for people who have disabilities, if you wish, or challenges. And indeed, we invited Michael Haddad, who happens to be a close friend, who is the UNDP regional ambassador for this issue, to the meeting, and we are addressing this. And today I read a tweet by our colleague, Dr. Firas Abiyad, about how there's a team from RHUC going in with the Salib Al-Ahmar to areas to go to people and give them the vaccine, people who cannot move around and who are displaced, who have disadvantages in that sense. Maybe جهاد العصفور عنده سؤال كان عم بيحكي. Judy.
Judy, you are muted, yeah, Judy.
Yes, thank you. My canary actually is my soulmate بالبيت, and every time the canary knows that there's a Zoom meeting or a meeting happening, there is always room for him to say a few words, and it usually overwhelms the meeting, so I have to put him outside.
So it's a real canary.
It's cold. I'm not going to put him outside because it's cold.
No, it's
I apologize. And so thank you, Fuad, for your candid talk and your reflection on things, and thanks, Talia Akid, for hosting every week very interesting guests. And I'm just I'm just going to contribute to the discussion just with a few points, so I can just think that I'm thinking out loud with you. So in terms of I'm thinking around globally, speaking about global health. So I'm going to just say one word on global health and talk about the current, the conditions of our planet today. And then the third point will be about access to vaccines and availability in Lebanon. So globally, we know that there are around 26 or 25 million refugees scattered all over the world. Some of them happen to fall, unfortunately, in countries such as ours that are not signatories in the 1951 Convention, as Fuad pointed out. And these people are considered illegal migrants, so we want to kick them out, or even incarcerate them. And there are a lot of people in jails today, maybe around 30 to 40%, according to the recent statistics, that are illegal migrants. They are not criminals, but they don't have the paperwork. So they were thrown in jail. So and so these are and so then what's happening to these people who are affected by different kinds of conflicts and crises all around the world are scattered in Lebanon and outside Lebanon. Some of them are fortunate enough to be, included in societies in some places such as Europe, and they are considered as not illegal migrants. They are considered, part of the population, which is great. So they have access to different kinds of services, including probably the vaccines. But don't quote me because I didn't check, but I'm just thinking out loud. So and when people all around the world, as many people as possible, get access to the vaccine, and we know there will be a lot of countries where the vaccine will not reach, such as countries that are already in war. يعني هلا ما بعرف أنا what's going to happen in Yemen, for example, and in other places. That has implications on global health. From my perspective, لأنه if you talk about herd immunity, where only the elitist societies in the world and industrialized nations and those who have the ability to either purchase the vaccines or to to get a hold of vaccines, then their populations will probably have a better chance of getting the vaccine, and the possibility of herd immunity there will increase. However, unfortunately, what's happening around the world, these world leaders that you call them world leaders, and I agree with Talia that the current situation in the world, despite this connectedness, which is a double-edged sword, في كتير gross inequalities between countries and within countries. And what's really interesting is that when we talk about pandemics, industrialized nations of the world, or world leaders, or rich countries, or high-income countries, call them what you want, tend to close their eyes to the needs of refugee populations all around the world. Unfortunately for us and the whole world, this has implications on herd immunity and global health. So the more people around the world, because of this connectedness, يعني إنه نحن, because of the global connectedness and the spread, يعني and the speed of people moving from one place to another, was a major factor for this pandemic to happen at the beginning, to begin with. Unfortunately, this is not taken into consideration during efforts to control, to manage to control with the vaccination. So that's one comment I think I want to, disappointing, يعني actually. And the other thing is بلبنان, يعني I don't know, but it looks like يعني we can, يعني people على الأرض can do things, can pressure leaders, can pressure the UN agencies, because the thing is that we are not allowed, يعني private companies, private groups, مؤسسات, are having a hard time to buy the vaccines, because it's usually for the COVID vaccine, it's the government that has a say. So everything has to go through the government. And if the government, here we go again, يعني the government doesn't want to, or for some political reason, or doesn't even take this into consideration, we're going to have a hard time with access to vaccines for refugees. And I think we can يعني at a local level, نحن عنا, we can try to advocate for this with the UNHCR and UN agencies, because there is risk to the refugees, but also risk to, يعني, if we look at it this way, risk to other people. And if refugees and other people in Lebanon do not get the vaccine for any reason at all, يعني, it's not going to give us any protection so one could use that justification, even though it's not a human rights framework or justification, but يعني, one could use anything that you can think of. And it could be possible, and يعني I see a light at the end of the tunnel, because recently, as you know, يعني هلا بلشنا بالvaccination for the frontliners, the medical healthcare workers and the medical team وإلى آخره. But also people in the age groups of 60 and above or 65 and above, including those who are bedridden. So I think the government hasn't really thought very, very well through this, and maybe this will come. And right after that, maybe refugees will come. But I think humanitarian agencies, especially Yali Lebanon, should be advocating. And I think they can get together and do this, because في نوع من conglomerate or a group of people working together from these agencies. And this could be high on the list. And maybe, I don't know if they're already talking about it, but I think there is potential. So I don't think it's a lost case, but it's not an easy one. That's what I'm saying. It's not an easy one. So then someone has to put the money and buy the vaccines to be distributed. And I think the UN agencies, UNHCR, etc., اللي هني مسؤولين عن refugees, should be able to, do this. But also كمان UNRWA, كمان, they have frontliners, There are medical doctors, there are nurses. And so I don't think there has been a lot of thought about this. ما بعرف فؤاد. I don't know, and others. I don't know if we in Lebanon have really seriously gotten a committee together, for example, to think about issues related to vaccination and refugees, or war-affected populations بلبنان. لأنه remember, هلا everyone has to register. It's not just, come and get it. The registration كمان is an issue. In addition to that, there's a lot of information that might not be accessible. The refugees, a lot of people don't understand what's happening, and a lot of people might not, get the right information. As we talked
So,
about
Judy, if I
tonight.
may, sorry to interrupt you, but if I may address this as a member of the COVID National Vaccination Committee, we do have people from UNHCR, we do have people from UNICEF, we do have people from UN agencies working on that.
Okay.
Yes, we made sure to include a big number of stakeholders, because, and this is a very important statement that was said once by the chair of the committee, Dr. Bizri, the vaccine is the right to everyone on Lebanese.
Exactly. Yes, a human rights perspective. So then there is hope. Yes.
We should never give up hope. Exactly.
Yeah. No, if you've already taken a step in the right direction,
absolutely,
then that's great. Good to hear. How about it?
Can I comment on that, Talia and Judy? I know, I don't want, but I think it's, definitely you put it well, Judy. It's beyond even the issue of availability. Yes, it could be available. Maybe UNHCR or UNRWA can advocate to and some secure fund to bring through the government the vaccine. It's fine, but the issue is beyond بس availability. As you said. When talking about, for example, you should register at this mobile application, I don't know. How many can have this access to do that? Who will do that on behalf of them? Is it the right way? What about the information? So there are few questions related to the way that you even register. Second, there's a sort of discussion about, as we're talking about legality, if people are illegal. So what about, they're sharing their information, their private information? Should they do that? Because they sort of fear sometimes. There are few questions related not just to the availability, but also accessibility and even beyond legality of these issues. So I think it's not enough. Of course, it's good to have people from UNHCR, people from UNRWA, people from whatever they want. But I think, I don't know if they have people from the community themselves. I don't know if they have people, I don't know if you have Syrian doctors that working in the community, which is they will not be able to be there in because they are working illegally. So that's the complexity of the issue of being a specific group that out of the mainstream. Yani I think I would bring it in its complexity more than goodwilling, which is definitely we are in that mood of goodwilling. أنا واحد منهم. But I think the reality is beyond goodwilling.
You do raise a very good point, Fuad, and Judy, of course. So I'm going to hold you accountable, as we say, and thus will talk to the chair of the committee, and perhaps we can have you both as visitors or as guests to our next meeting, because refugees, I think, is meant for phase 3. If they don't have comorbidities, if they're not healthcare workers, etc. So we can learn a lot from your expertise, if that's okay with you.
I'm ready to help if I can. يعني إنه فؤاد بيعرف على الأرض شو عم بيصير I think أكتر مني بس أنا I can if I can be of any help يعني from a different perspective I'm more than willing أكيد.
Sure, we will address this definitely, and I want to be respectful of the time unless there are other requests. Are there any comments or questions? So
no, it doesn't seem there's any.
Okay. So thank you all for joining, and Dr. Fuad, thanks a lot for this intellectually stimulating discussion. It was a pleasure having you with us. We will keep in touch definitely. And thank you, everyone, Diana, Tyler, and our colleagues.
Thank you. Thank you for giving this opportunity, Talia. And thank you all for having this great discussion.
Thank you. Good night.
Have a good evening all. Bye-bye.
Bye-bye. Bye. Thank you.
Thank you.